Introduction: The diagnostic challenge of oral blisters, navigating the nuances, a deep dive into Bullous Lichen Planus and related oral blistering conditions. Imagine a patient presents with persistent, painful oral blisters. Is it a common canker sore or something far more complex? The world of oral blistering conditions can be a diagnostic minefield, often presenting with overlapping symptoms that challenge even the most experienced healthcare professionals. Today, we are going to unravel this complexity, focusing on a particular rare yet crucial diagnosis, Bullous Lichen Planus, and how to differentiate from other significant oral mucocutaneous disorders. Let's begin by understanding the case that illustrate the diagnostic challenges. The patient journal, a case study in oral lesion. We'll start with detailed case. A 73-year-old woman developed oral blister and lip dryness in July 2023, noticing discomfort, especially during toothbrushing. Her symptoms worsened with closest toothpaste and consumption of spicy and acidic foods. Importantly, she denied any lesion outside her mouth. Clinically, we observed white lace striations on both her lips, as well as on the posterior buccal mucosa, ventral tongue, and floor of the mouth. Additionally, intact fluid-filled bullae approximately 5 mm in diameter were present on the upper right and lower left labial mucosa. Histopathological revealed a dense subepithelial lymphatic band, subepithelial splitting, and degenerating basal keratinocytes known as cavity body. However, direct immunofluorescence produced negative results for IgG, IgM, IgA, and complement 3. This clinical and histopathological picture points us towards a specific diagnosis, but it's crucial to understand why certain other conditions were ruled out. Unpacking the diagnosis, Bullous Lichen Planus. Based on the clinical presentation of white lace striations alongside fluid-filled bullae, coupled with the histopathological finding of subepithelial splitting, it's also called Max Joseph space, and cavity bodies, and a negative direct immunofluorescence for immunoglobulin and complement proteins. The diagnosis is Bullous Lichen Planus, or BLP. BLP is a rare form of oral lichen planus, OLP, that includes fluid-filled vesicles or bullae in addition to typical OLP features. OLP itself is a chronic immune-mediated mucocutaneous disorder. Histologically, OLP can show hyperkeratosis, acanthosis, or atrophy, sawtooth ridge, and diffuse subepithelial lymphatic infiltrates. The presence of cavity body and subepithelial clefting are also key features. A crucial differentiator here is a negative direct immunofluorescence, as DIF in OLP typically shows fibrinogen staining of basement membrane, with C3 and immunoglobulin detected to a much less extent. While BLP might be the diagnosis in this case, a thorough differentiation is paramount to avoid misidentification, particularly with conditions that share similar presentations. Differential diagnosis. A critical distinction. It is vital to differentiate BLP from other blistering conditions. First, lichen planus pemphigoides, LPP, an autoimmune subepithelial blistering condition, primarily targets type 17 collagen in the hemidesmosomes. Well, it presents with tense bullae that might be associated with existing lichenoid lesions. Its defining characteristic on direct immunofluorescence is strong linear positivity to IgG, IgA, and complementary in the basement membrane zone, which was absent in our case. Second, mucous membrane pemphigoid, MMP, another subepithelial autoimmune blistering condition, affects complements of the desmosomes and can manifest with discriminative gingivitis, ulcerations, and vascular or bully. Crucially, MMP shows a linear deposition of IgG, IgA, IgM, and Th3 in the basement membrane zone on DRF. And finally, pemphigus vulgaris (PV) is a mucocutaneous autoimmune blistering condition characterized by immunoglobulin deposition against desmosomes, leading to painful intraepithelial blisters. Histologically, PV shows intraepithelial clefting and acantholysis, which preserve basal keratinocytes, and DRF reveals IgG deposition in a desmosomal fishnet-like pattern, distinct from our case. Recognizing this subtle but critical difference is key to accurate diagnosis and effective patient management. Management and prognosis, tailoring treatment for optimal outcomes. Management of these conditions is tailored to patient symptoms, clinical severity, and any extraoral involvement. For BLP, the treatment of choice is typically topical or systemic corticosteroids. Frequently recall appointments are encouraged for thorough evaluation. The importance of accurate diagnosis can't be overstated due to the substantial difference in prognosis between these conditions. For instance, oral LPP is considered a systemic autoimmune disease that can lead to progressive scarring of the conjunctiva, potentially resulting in blindness and scarring of other mucosal sites, which can cause respiratory distress and dysphagia. This highlights why precise differentiation, especially through direct immunofluorescence, is absolutely critical. In conclusion, mastering the diagnosis of an oral blistering condition is not just about identifying the problem, but about protecting our patients' long-term health and well-being. Conclusion: the importance of precision in oral medicine. As healthcare professionals in dentistry, our ability to accurately diagnose conditions like Bullous Lichen Planus and distinguishing them from look-alike Lichen Planus, pemphigoides, mucous membrane pemphigoid, and pemphigus vulgaris is paramount. The subtle clinical signs, combined with definitive histopathological findings and particularly direct immunofluorescence forms a cornerstone of precise diagnosis. Remember, an underdiagnosed condition like oral LPP can have severe systemic implications. By staying vigilant and applying these diagnostic principles, we can significantly impact our patients' lives, ensuring they receive the correct treatment and optimal care. Thank you for joining us in this deep dive into oral blistering conditions.